Welcome to Health Steps 24/7. I'm Chris, your social media pharmacist. Today I will be providing answers to very important questions on oral sex. Become a health stepper. Walk more. Count those steps. Enjoy your walk. Subscribe to Health Steps 24/7. Oral sex questions that will be answered during my sexual health talk are: what is oral sex? Is oral sex real sex? What is the difference between fellatio, cunnilingus, and anilingus? What is 69? Is oral sex safer than vaginal or anal sex? What can increase the risk of getting or giving a sexually transmitted disease when performing oral sex? How to avoid sexually transmitted diseases or STDs when performing oral sex. Let's start with the first question. What is oral sex? Oral sex, sometimes called oral intercourse, is a commonly practiced sexual activity by couples that involves the stimulation of the genitalia or anus of a partner by the other partner using their mouth, lips, or tongue. The female genitalia or genitals include the labia majora, labia minora, clitoris, and vagina. The labia majora, the fleshy outer part of the vulva, is also called the outer lips, while the labia minora, which is closer to the vaginal opening, is also called the inner lips. The male genitalia or genitals include the penis, scrotum, and testicles. The scrotum or scrotal sac, also called the ball sac, is the sac of skin that hangs below the penis. The scrotum is covered with wrinkly skin and hair. The testicles, also called the balls, are two ball-like sacs found in the scrotum. The testicles make sperm and testosterone. Oral sex gives couples another way to provide pleasure to each other. Oral sex is often done as a part of foreplay, that is, before sexual intercourse. Many couples include oral sex in their sexual activity as a way to warm up or to get in the mood before sexual penetration or sexual intercourse. Let's move on to the next question. Is oral sex real sex? Some persons engage in oral sex because they consider it lower risk as compared to sexual intercourse, or they do not want to become pregnant or want to preserve their virginity. While oral sex does not cause pregnancy, this does not mean that oral sex is not real sex. Just like other types of sex, oral sex can provide intense pleasure for both men and women, result in orgasms, and keep couples connected emotionally. Oral sex cannot be regarded as a lesser form of sex because it does not involve sexual penetration of the penis in the vagina or anus. Just like other types of sex, oral sex can also cause STDs. Oral sex is real sex. Let's go to question number 3. What is the difference between fellatio, cunnilingus, and anilingus? Fellatio, cunnilingus, and anilingus are all acts of oral sex. But how are they different from each other? Fellatio is when one partner stimulates the penis of the other partner using their mouth, lips, or tongue. Fellatio can also involve the stimulation of the scrotum of one partner by the other partner using their mouth, lips, or tongue. Cunnilingus is when one partner stimulates the vagina and vulva, for example the clitoris, of the other partner using their mouth, lips, or tongue. The clitoris is the most sensitive part of the female anatomy. Therefore, stimulation of the clitoris can result in arousal and orgasm. Anilingus, also known as anal oral sex, is when one partner stimulates the anus of the other partner using their mouth, lips, or tongue. Question 4. What is 69? 69, or the 69 position, is when two partners perform oral sex on each other at the same time. The name 69 was given to this sex act because the body position of both partners involved look like the numbers 6 and 9, where one partner lies down on their back while the other partner climbs on top and turns around, straddling their partner's head with the vagina, penis, or anus above the face. The partner on top leans forward and begins oral sex on their partner, while the other partner gives oral sex to their partner on top at the same time. Question number 5. Is oral sex safer than vaginal or anal sex? Not exactly. While oral sex can provide the same intense pleasure and emotional connection like sexual intercourse without the worry of an unwanted pregnancy, oral sex also has one of the same risks as sexual intercourse. As is the case with sexual intercourse, oral sex can also spread sexually transmitted diseases or STDs, including gonorrhea, chlamydia, syphilis, herpes, human papilloma virus or HPV, and HIV. It does not matter whether a person is giving or receiving oral sex, they can spread or contract a sexually transmitted disease while performing oral sex. Let's look at question 6. What can increase the risk of getting or giving a sexually transmitted disease when performing oral sex? A person's chances or risk of getting an STD from an infected partner or giving an STD to their partner while performing oral sex can be increased if the person has sores in the mouth or the genital area, such as the clitoris, vagina, or penis, has sores on the anus, has poor oral health, such as gum disease, bleeding gums, and tooth decay, has been exposed to precum, also called pre-ejaculatory fluid, or pre-ejaculate of an infected partner, has been exposed to cum, also called ejaculatory fluid or semen of an infected partner, has unprotected oral sex with an infected partner. Let's move on to question number 7, the last question for this video. How to avoid sexually transmitted diseases or STDs transmission when performing oral sex. Both persons should be tested for sexually transmitted diseases or STDs before engaging in oral sex. If one partner is not sure about the other partner or their own STD's status, that person can reduce their chances of getting or giving a sexually transmitted disease while performing oral sex by using a condom or dental dam every time they give or receive oral sex from their partner. When a person is performing oral sex on the vagina or anus, they should always use a dental dam. When a person is performing oral sex on the penis, they should cover the penis with a non-lubricated latex condom. If one partner is allergic to latex condoms, a polyurethane or a plastic condom should be used during oral sex. Protection against STDs during oral sex is not only achieved by using a polyurethane or non-latex condom or dental dam, but also by ensuring the condom or dental dam is stored and used the right way. A condom or dental dam must be used the right way every time a person performs oral sex. Therefore, it is important to follow the instructions on storage and use provided by the manufacturer of the condom or dental dam. I will now give you a few tips on storing condoms. Tip number 1. Condoms should be stored at room temperature in a dry place. Tip number 2. Extreme temperature can damage condoms. Tip number 3. Do not expose condoms to direct sunlight. Sunlight can break down condoms faster. Tip number 4. Do not keep condoms in your wallet for more than 1 month. Tip number 5. Always keep sharp objects like scissors, razors, and knives away from condoms. Thanks for watching this video. Feel free to comment, like, share, and subscribe to this channel. Join me next time for more health videos. Bye for now.